Welcome to Nurses Showdown, Clinical Knowledge Battleground. With me today, I have two amazing nurses, but before I let you know who they are, my name is Felicia Ibinosa. I'm your amazing host for this epic first ever game show for nurses. And I have with me Tara, a nurse representing the peds, and she also has background in med-surg tele. And I have Amanda here representing med-surg. All right, welcome you guys. I appreciate you guys joining me here for today's episode. So I'm going to have you guys start off by introducing yourselves, starting with Amanda. Let us know who you are. Your background in nursing, and how long you've been a nurse.
Okay. Hello, my name is Amanda. I have been in nursing since about 2010. I started off as a CNA, got my LVN, got my RN, bachelor's, and then my master's. And I currently am a clinical manager on med-surg.
Very good. Welcome, and thank you for joining us today. Amanda, over to you, Tara. Let us know who you are, your background, and how long you've been a nurse.
I also started out as a CNA, and I did that for about 10 years. I've been a nurse for 6.5, going on 7. I specialize in pediatrics, do some time in NICU. I also do a little bit of med-surg tele, and I am a lactation consultant.
Ooh, all right. Okay. Very good. Thank you so much, Sarah, for joining us today, and welcome to Nurses Showdown. All right, before we forge ahead, I just have to put a little disclaimer out there for our viewers. This show is meant to be entertaining, educational, and engaging. So please, by no means, use whatever information you get from this show or from this episode as the sole basis for your nursing practice. So please be sure you are following your facility's protocols, the policies, and their guidelines, as well as your doctor's order. Again, make sure you're not using the information from this show or from this episode as the main basis for your clinical practice at work. Now, with that said, let's go over the rules. Are we ready for the rules?
No. Okay.
All right. specialty. So you're going to be getting questions from anywhere across nursing. We're talking about psych, we're talking about OB, L&D, NICU, telemed-surg, ICU, ED, case management. You're going to be hit from all directions. Are you ready for this?
No.
All right, we're gonna tickle your brain a little bit with this show. Okay, let's see what you still remember from nursing school, right? Okay, so talking about Gems and Scrubs. Gems and Scrubs is sponsoring this show, and we just want to give them a shout out for extending a hand of sponsorship to this show, and we are gladly accepting it. So yay, Gems and Scrubs. The scrubs are absolutely fabulous, fashionable, comfortable. I mean, I wear them to work, and I see nurses wear them to work, and they look absolutely fabulous. Okay? All right. Nurses, are you ready?
Yes.
Are you sure you're ready for this?
No.
Okay. All right. So let's get into the show proper. Tara, choose a number between 1 and 10.
3.
Number 3. Okay. Question number 3. A 59-year-old with diabetes has 10 days of severe midline back pain, fever, elevated inflammatory markers, and increasing night pain. What is the most appropriate immediate action? A. Obtain blood cultures. B. Obtain an MRI of the spine and consult spine surgery. C. Start empiric IV antibiotics and consult infectious disease. D. All of the above. 10 seconds starts now. Three, 2, 1. Show your answers. D. Very good. Tara, tell us why you chose D.
Well, someone who's diabetic is at high risk for infection. So I'm immediately going to think about blood cultures and antibiotics, but you can't start antibiotics until you've got your blood cultures. And with the back pain and the elevated inflammatory markers, we'd be concerned about what's happening in the back. Could there be an abscess or something else going on there? You want to know where all this is coming from.
Okay, all right, very good. Amanda, let us know why you chose D.
She was kind of right on point with it. Given the different things that the patient's experiencing, they are high risk for infections. You would want to do a sepsis protocol with just starting the antibiotics, obtaining the blood cultures, things like that. Obtaining the MRI will give us visualization of what's going on, whether it's an abscess or something like she said. So you would want to do all of the above.
Okay, very good. Let's see if you're both correct. Answer reveal coming right up. And yes, you're both correct. Here is why we would do all of the above. Vertebral osteomyelitis requires prompt imaging, such as the MRI, blood cultures, and empiric IV antibiotics after cultures to prevent neurologic complications. Specialist input is very important for management. Very good, nurses. Amanda, choose a number between 1 and 10.
7.
7. Lucky number 7.
I said it's going to be a dialysis question. You just wait.
Okay, not a dialysis question.
Yay.
Question 7. A 65-year-old with COPD on the med-surg unit becomes more short of breath with increased use of accessory muscles and SpO2 88% on 2 liters nasal cannula. Breath sounds reveal diffuse wheezes. What is the nurse's priority action? A. Increase supplemental oxygen to 6 liter and call rapid response. B. Give nebulized bronchodilator such as the albuterol and reassess oxygenation. C. Immediately intubate the patient. D. Place patient supine and observe. You have 10 seconds. Three, 2, 1. Show your answers. B. What'd you choose? I can't see your answer, Tara. Oh,
B.
there you go. B. Okay, you
I'll
both chose
do it next
B.
time, sorry.
Amanda, let us know why you chose B.
I chose B because with COPD, you do not want to increase their oxygen up to 6 liters because sometimes that will depress their oxygen drive even more. I thought maybe calling a rapid response, but the first part of it cut me out. And then you do not immediately intubate, and you don't want to lay them flat when they're having trouble breathing. So giving a nebulized bronchodilator. However, for us, we don't usually give those. Respiratory does.
Yeah.
So
At
at
least you know
first
what
it
to
kinda threw me
you
off.
know what to ask for when you call the
Exactly.
respiratory therapy.
Yep.
Okay,
So
all right. How
B.
about you, Tara? Why did you choose B?
Literally everything she just said. We don't want to overinflate. You can't give too much oxygen on a COPD patient. It'll overinflate the alveoli, and so first one's out. We're wheezing. We're constricted, so obviously we need a bronchodilator. Yeah, there's definitely no reason to intubate right now, and we're definitely not going to walk away from a patient who is not oxygenating.
Okay, all right. Very good. Let's see if you're both correct. And yes, you are both correct. Woo-hoo! All right, give nebulized bronchodilators and reassess oxygenation. And here is why we will do this. Acute COPD exacerbation with wheezing is best initially treated with bronchodilators and possibly systemic steroids. Oxygen should be titrated carefully to maintain target saturation, usually between 88 to 92%. Rather than simply increasing flow excessively, immediate intubation is not first line unless respiratory failure is present. All right. Okay. Tara, number between 1 and 10.
5.
5. Okay. Question 5. The patient on oxytocin develops uterine tachycystole, more than 5 contractions in 10 minutes, and late decelerations occur. What is the best action to ensure a smooth... okay, this one here is not the... What is the best action? A. Stop the oxytocin. B. Reposition the mother and give oxygen. C. Begin maternal pushing efforts immediately. D. A and B. You have 10 seconds. Three, 2, 1. Show your answers.
Oh, I guess it's that one.
Okay. Okay.
It's D.
You both chose D. All right, Tara, let us know why you chose D.
You have to stop the oxytocin because we're contracting too quickly and that's stimulating the contractions. So stopping that will help to slow it down. But you also want to start oxygen because it's contracting so much. That puts a lot of stress on the baby. The D cells, the baby's not getting enough oxygen. So we want to increase oxygen for the mother to help get more oxygen to the baby. And reposition mom, because sometimes that can help release the pressure, slow down the contractions, and relieve the stress on the baby. Sometimes the positioning can help relieve some of that stress.
Okay, all right, very good, very detailed. All right, Amanda, let us know why you chose D.
So the same thing she did, patients on oxytocin and she's contracting too much. So you want to stop the oxytocin to slow it down. And then you want to reposition the mom to help increase the placental, blood flow and oxygen and all of that. And then give mom oxygen because that's going to help get more oxygen down to the baby.
Okay. All right. Let's see if you're both. And you wanted to add something?
And that also goes with veal chop. Late D cells, placental insufficiency.
Veal chop. All right.
Veal chop. Huh?
Then you go, girl.
Right.
That's the only acronym I remember from nursing school is veal chop and wet frog.
See, I never heard of veal chop and wet frog in nursing school. So that's new. Very good, very good. She just had to add that.
Yeah, I had to add that.
Mm-hmm.
The veal chop.
All right, let's see if you're both correct. And yes, you both are. Woo! All right, and here is why we would do A and B. Uterine tachycystole can reduce uteroplacental perfusion and cause late decelerations. Immediate actions include stopping oxytocin, intrauterine resuscitation such as repositioning, providing oxygen and IV bolus, and notifying the provider are important. Tocolytics may be used per protocol if tachycystole persists. Tocolytics is those are the little thing they put on the stomach, right? To trace the baby.
It's like magnesium, right?
The pink and the blue thingy, and they tie it around the mom's pregnant belly. Isn't that Toco?
It's a Toco monitor.
Toco monitor. There you go.
But a tocolytic would be like something like magnesium, I think.
Yes. Yeah. Okay. Yeah. See.
Yeah.
I knew there was Toco somewhere. At least I didn't say taco.
I like tacos.
Right?
Those are my love language.
Exactly. I don't think I've ever met a nurse who doesn't like tacos.
Because we know what's up.
Exactly.
All right. Okay. So, Amanda, a number between 1 and 10.
Let's do number 1.
Number 1. Okay. Okay. All right. Question number 1. A 28-year-old patient with schizophrenia reports hearing a voice commanding them to harm themselves. They refuse to give specifics but seem distressed. What is the nurse's best immediate action? A. Respect privacy and wait for the patient to volunteer more information. B. Initiate continuous observation, 1-to-1, remove potential means, conduct a focused suicide risk assessment, and notify the treatment team immediately. C. Tell the patient the voices are not real and to ignore them. D. Discharge the patient once they appear calm. You have 10 seconds. Three, 2, 1. Show your answers. B. Very good. Okay, Amanda, why did you choose B?
Because the minute somebody presents with any suicidal ideation or homicidal ideation, you initiate the process of getting a one-to-one, making sure you maintain their safety, checking their suicide risk, ordering a telepsych usually, and notifying the doctor immediately. You don't want to respect their privacy because they are at risk for suicide. You don't want to tell the patient the voices aren't real because they're schizophrenic, and that can usually trigger them to be, more angry or hostile. And then you don't want to discharge them until they've been cleared by psych.
Okay. All right, very good. Tara, why did you choose B?
I'm not sure if I can add anything to that. Literally everything she said. It would be a huge safety risk to leave them alone at all. You would initiate the protocol like at their bedside. You would not leave them alone.
Nope.
You would have to have someone, you would have to stay with them or have someone stay with them while you got everything into place because they're immediately at risk.
Okay. All right. Let's see if you're both correct.
Ding.
And yes. Woo! Very good, very good. And
Alicia, where's the hard questions today?
the hard question. Oh, okay. All right. They're coming right up. You want to be challenged more, all right?
Yes.
All right, so here is the rationale for this. Combined auditory hallucinations increase risk, especially when they involve self-harm. Immediate steps ensure safety, one-to-one observation, and remove means they could use to harm themselves. Perform a focused risk assessment and notify the team so protective interventions can be implemented. Waiting or minimizing delays action. Discharge is unsafe. All right.
Good.
Very good, very good. Tara, a question between 1 and 10.
9.
Question 9. All right. A patient is alert but reports palpitations and mild dizziness. Blood pressure is 120/70 and SpO2 is 97% on oxygen. EKG shows a sustained wide complex tachycardia at 170 beats per minute. What is the most appropriate immediate action? A. Immediate unsynchronized defibrillation. B. Attempt rate control with IV amiodarone while preparing for possible synchronized cardioversion. C. Vagal maneuvers. D. Don't treat the heart rate since blood pressure is acceptable. You have 10 seconds. Three, 2, 1. Show your answers. Now we're talking, okay? Tara, why did you choose C?
Well, I think we try vagal maneuvers before we use amiodarone or do synchronized cardioversion, and we never do unsynchronized defibrillation that I know of. But we do want to get rid of that. But it sounds like the patient's alert and with us. So, and sometimes you can fix that with vagal maneuvers. So, like, usually you would try that first while you contact the doctor, and if that doesn't work, while you're setting up for amiodarone or synchronized cardioversion.
Okay. All right. Very good. Very good. Amanda, why did you choose? What did you choose? B?
I chose B.
You chose B.
Except I'm questioning myself now. I feel like I remember hearing about this one, or I feel like somebody had said once that you can't do vagal nerve maneuvers with a wide complex tachycardia. But now I think it might have been a narrow complex tachycardia. Honestly, that was my thought process. Is I don't think you can do vagal maneuvers with wide complex, so that's why I went with the attempt the rate control with amiodarone and then cardioversion. You wouldn't do an unsynchronized defibrillation, and you don't just not treat it.
I could have switched that.
I was like, I can't remember if I switched it or not.
Me either. Oh, now I'm questioning.
Okay, are we sticking with the same answers?
Yes.
Yes.
Yes. Okay, let's see which one of you is correct. B.
Yay! Yay! Thank you.
All right. Amanda is correct. Attempt rate control with IV amiodarone while preparing for possible synchronized cardioversion, and here is why. A stable patient with wide complex tachycardia and a pulse should receive anti-arrhythmic therapy such as IV amiodarone and be prepared for synchronized cardioversion if instability develops. Unsynchronized defibrillation is for pulseless ventricular arrhythmias. Vagal maneuvers are ineffective for most ventricular tachycardias, and ignoring the rhythm risk rapid deterioration. So the attempting rate control is with amio, and synchronized is usually for VTACs. The narrow complex one, that's when you use the vagal maneuver, because those are more like SVTs, sinus tract and all those. Yes.
I flipped them.
So it's like, I don't remember where I heard the question before, but I feel like I don't know.
That's why you're the boss. That's why they put you in charge of your floor.
That's why I call ICU.
Like, call rapid response, come get your patient. You're
Yeah,
not supposed to be doing this on my floor.
Take them with you.
All right. Who's next? Amanda.
Let's do number 10.
Number 10. Okay. Question 10. A 68-year-old man presents with sudden left-sided weakness and aphasia 90 minutes after last known well. CT head shows no hemorrhage. Blood pressure on arrival is 195 over 118 millimeter mercury. What is the most appropriate immediate action? A. Give IV autoplace immediately despite the blood pressure. B. Treat blood pressure with IV antihypertensive to achieve a blood pressure below 185 over 110, then evaluate for IV autoplace. C. Send home with outpatient follow-up. D. Give aspirin and observe. You have 10 seconds. Three, 2, 1. Show your answers. Amanda, be careful what you ask for. You asked for a challenge.
I
know. Okay. Okay. Who chose number 10? Okay, that's Amanda. Why did you choose number 8?
I chose letter A because sometimes you're not going to be able to get the blood pressure down, and I feel like they have time limits and time windows for the stroke protocol, that waiting to get the blood pressure down isn't always going to be your best choice. I think giving the alteplase, if the CT showed no hemorrhage, I feel like giving the alteplase despite the blood pressure would be your best bet.
Okay.
Maybe.
Okay. Tara, why did you choose B?
I'm questioning my answer now. because ideally you would give it in the right range, and sometimes you can get that blood pressure down with treatment relatively quickly. And I just personally don't know enough about Alteplase because I've never given it to know if, like, what will happen if we give it and we're way out of range.
Okay.
So I was trying to go with the safer route.
The risk of giving it when it's out of range is that it becomes hemorrhagic, or it's already hemorrhagic and it causes more bleeding. But I don't know.
Oh, but we're not bleeding. So,
Exactly.
Yeah.
So I don't know. At least it says we're not bleeding. They always catch strokes on the MRIs, not the CTs.
Oh, that's true. I would send them to MRI is what I do. That's how you know I'd send them to MRI.
Okay.
Wrote this protocol.
Right. I don't read the beginning of the protocol. It's not my floor.
You don't read the beginning of the protocol.
I know the emergency part, and then the my part. I don't know what yeah.
Okay, are we ready for the answer reveal?
Yes.
Yes.
Here it comes. Your answer is B. Very good,
Good job, Tara.
Treats blood pressure with IV antihypertensive to achieve a blood pressure below 185 over 110. Then evaluate for IV Alteplase, and here is why. IV Alteplase eligibility requires a blood pressure below 185 over 100 millimeter mercury prior to treatment to reduce hemorrhagic risk. Rapid blood pressure lowering with approved IV agents such as labetalol or nicardipine is recommended before administering Alteplase. Here you go. Okay, Tara, choose a number between 1 and 10.
2.
2. Question 2. A 9-month-old infant with wheeze, cough, and low-grade fever presents with moderate respiratory distress and O2 saturation 92% on room air. What is the most appropriate immediate action? A. Start broad-spectrum antibiotics immediately. B. Routinely give albuterol and systemic corticosteroids to the patient. C. Provide supportive care such as hydration, suctioning of secretions, oxygen if saturation is low. Avoid routine bronchodilators or systemic steroids unless specifically indicated. D. A and C. You have 10 seconds. Three, 2, 1. Show your answers. C. Okay, Tara chose C. Amanda chose D. Okay. Tara, why did you choose C?
In an infant that young, or at that age, they're not so young that we would immediately start antibiotics without checking blood cultures and doing labs, usually, because they are a little older. A lot of times things are viral. So we're doing supportive care, hydration, suctioning, oxygen, bronchodilators and steroids when they're needed. Tylenol, like that's kind of more the normal if it's a viral process, but it's often a viral process unless it's shown to be otherwise upon initial. my preferred choice would have been B and C, but that wasn't an option because there was wheezing.
Okay. All right. Very good. Amanda, why did you choose D?
Because my brain immediately went to adult with a fever and give antibiotics. But now I'm questioning that. I was thinking infection, antibiotics, and then provide the supportive care. I probably would have put A and B if that was an option. But
if it was
missing the part that it was a 9-month-old, yeah.
If it was a 6-week-old, I would immediately put A and C.
Gotcha.
But in a 9-month-old, I wouldn't necessarily immediately start antibiotics.
Okay. All right. Well, let's see who's the real Pete's nurse here, right? Answer reveal coming right up. And Tara is the Pete's nurse.
Tara is the Pete's nurse.
Provide supportive care, hydration, suctioning of secretions, oxygen if saturation is low, avoid routine bronchodilators or systemic steroids unless specifically indicated. And here is why. Guidelines recommend supportive care for bronchiolitis. Maintain hydration, nasal suctioning, and give supplemental oxygen when needed. Routine bronchodilators, epinephrine, or systemic corticosteroids are generally not recommended in typical bronchiolitis. Imaging and viral testing are often unnecessary and do not change the management. Okay, very good, very good. Amanda, number between 1 and 10.
6.
Number 6. Okay, question number 6. During shoulder dystocia, which of the following maneuvers is contraindicated because it may worsen impaction? A. McRoberts maneuver, which is the maternal leg hyperflexion. B. Suprapubic pressure. C. Fundal pressure. D. Delivery of posterior arm. 10 seconds. Starts now. Three, 2, 1. Show your answers. A and B. Okay. Amanda, why did you choose B?
I feel like putting pressure on the suprapubic area can just cause more pressure on trying to get them out. I don't know. I don't know any of them. So.
Okay. All right. Tara, why did you choose A?
Kind of the same thing. I felt like that kind of pullback pressure might cause pressure the wrong direction, but I'm not really sure. This is not my wheelhouse.
That was a guess out of both of us.
Yeah.
Okay.
I don't know anything about funduses.
I know you massage them.
You massage them.
That's what I know about funduses. You massage them when they're boggy.
All right, so let's see which one of you is actually correct. We're ready?
Okay.
Fundal pressure.
Neither one of us. Well.
Fundal pressure is contraindicated, and here is why. Fundal pressure is contraindicated in shoulder dystocia as it can further impact the anterior shoulder and worsen cord compression or fetal injury. McRoberts and suprapubic pressure are first line.
Well,
Delivery of the posterior arm is used if initial maneuvers fail. But frontal pressure is the one you don't want to do at all.
Well, we know who doesn't belong in labor and delivery.
That's right.
All right. Okay, so Tara, number between 1 and 10.
8.
Okay. Okay, question number 8 coming right up. Okay, number 8. A patient with acute psychosis refuses antipsychotic medication, stating they do not trust the staff. The team is concerned because the patient has been escalating and threatened another patient. What should the nurse do first? A. Force medication immediately. B. Assess the patient's decision-making capacity regarding the medication and document findings. C. Follow legal and organizational procedures for involuntary treatment if the patient lacks capacity or poses imminent danger. D. B and C. You have 10 seconds. Three, 2, 1. Show your answers. Okay, you both chose D. Okay, Tara, why did you choose D?
Well, if the patient has acute psychosis, they're refusing. We're concerned about the safety of that patient as well as the safety of others. They're possibly not in their right state of mind. We want to make sure, do they have the ability to consent, or do we need to make them do this? We need to make sure they have decision-making capacity. If they don't, we need to follow the correct procedures so that this patient is safe, as well as all of the rest of the patients we are caring for.
Okay, all right, very good. Amanda, why did you choose D?
What she said, he would assess their decision-making capacity. That way you could determine if they have the capacity to make decisions. But realistically, that's going to be, the doctor or telepsych or anything like that. But then we would follow our protocol and procedures to determine if we can give them the medication, considering they are, unsafe for themselves and the patients surrounding them.
Okay, all right, very good. Let's see if you're both correct. And yes, you both are. Assess the patient's decision-making capacity regarding the medication, document findings, and follow legal/organizational procedures for involuntary treatment if the patient lacks capacity or poses imminent danger. And here is why. Respect for autonomy requires assessing capacity. If the patient lacks capacity and is a danger to self or others, involuntary treatment may be lawful and necessary following policy. Forcing medication without assessment or coercion is inappropriate, ignoring the risks and dangers safety. Very good, nurses. So now we only have one question, and that's for Amanda. Question number 4. Question number 4. An 18-month-old toddler with multiple days of vomiting and diarrhea is mildly dehydrated but able to take some liquids by mouth. It's able to take some liquids by mouth. What is your appropriate immediate action? A. Offer oral rehydration solution and small frequent feeds. Reserve IV fluids for moderate severe dehydration or inability to tolerate ORS, which is oral rehydration solution. B. Suspect gastroenteritis and immediately start large volume IV bolus for the patient. C, withhold fluids to rest the gut. D, B, and C. You have 10 seconds. Three, two, one. Show your answers. D. Okay. So why did you choose D, Amanda?
I chose D because it does say that they're only mildly dehydrated, but because it's been multiple days, it doesn't seem like it's just a quick thing. So I feel like gastroenteritis is probably your best bet. And then if they're not able to really hydrate themselves, then you would want to give them IV fluids and let their gut rest so that way it can improve.
Okay. All right. Tara, why did you choose D?
Basically the same thing. Often because they're mildly dehydrated, we do want to give them the opportunity to get rehydrated. But often with gastroenteritis, if we don't give the gut an opportunity to take a break, it just stays inflamed.
Okay. All right. Here comes your answer reveal. Why are you holding on to that pen so tightly, Amanda?
I'm curious if we're wrong or not.
Right?
I don't know yet.
All right.
There
Here
was
it comes.
a shortage last year. They're going to be like, no fluids.
No fluids for you.
The answer is A.
Lie.
The answer is A. Offer oral rehydration solution in small frequent feeds. Reserve IV fluids for moderate to severe dehydration or inability to tolerate ORS. Remember, the question says the patient is still able to take fluids.
To take small amounts, and they're still vomiting.
Yeah, that's why it says small frequent feeds and oral hydration. You do a oh, here's why. Let's see what the rationale says, okay? For mild to moderate dehydration in children, oral rehydration with pediatric ORS is effective and recommended. IV fluids are reserved for severe dehydration, shock, or when the child cannot tolerate oral intake. Avoid hypotonic or high sugar fluids, such as the undiluted soda, for rehydration.
Fine. I don't agree.
You don't? Let's
No.
talk
And-
about it.
And why would you give soda?
Exactly. Who gets soda?
Who gives soda to a baby?
I did have a toddler once who was admitting for nausea and vomiting, and when they hit the floor, they were sitting up on the gurney eating hot Cheetos.
Oh my gosh. No wonder they're nauseous and vomiting.
Exactly. We were like, this is why you're here.
Well,
I don't know.
They're eating hot Cheetos.
Eating hot Cheetos. My manager at the time was like, nope, this one's mine.
I say my son's 2 and he devours hot Cheetos. I know it's horrible.
Yeah, probably not when he's in the hospital for vomiting.
Exactly.
Yeah.
Oh gosh.
All right. So I guess, when the patient is still able to tolerate, oral intake, you just want to do it with small frequency. As opposed to just keeping them NPO. Now, maybe if they are coming in with like stomach pain or and it's more like a pancreatitis, then at that point you want to put them on bowel rest, keep them NPO, then just give IV fluids and pain management. But this is gastroenteritis.
But I feel like that's contradictory. They're saying that they're vomiting, but then they said they're tolerating orals. If they're vomiting, they're not tolerating orals.
Exactly.
Contradicting statements.
Well, yeah, I see your points there. Yeah, that does sound a bit contradictory, but All right, but that's a good point. That's a good point to bring up. Okay, so that was the last question.
I failed this test.
You did not fail this test. We were almost identical.
Almost.
We both got like close to 60%. We failed.
That just means there weren't enough questions.
Oh, okay. We need more questions.
We need more questions.
You need more questions? Okay, I have one for you. Even though for this episode, Tara is clearly the winner. Yeah.
I did not expect that at all. I was fully prepared to lose.
She's clearly the winner. But hey, just for the heck of it, let's do one more question. I think you guys will find very, very fun. Are you ready?
Yes.
Okay.
It better not be a dialysis question.
The answer is potassium.
What is pneumo ultra microscopic silicovolcanoconiosis?
What? That's a word?
Pneumo ultra microscopic.
Now I'm lost.
Where's the answers?
Are we ready for the answer options?
Yeah.
A lung disease caused by inhalation of extremely fine silico particles.
Okay.
B, a type of brain tumor derived from both oligodendrocyte and astrocytes. C, a psychoactive compound sometimes encountered in toxicology. D, a rare blood disorder caused by complement mediated destruction of red blood cells. You have 10 seconds. Okay. 3, 2, 1. Show your answers. Hey. Okay. Now, since you showed your answer first, Sarah, why did you choose A?
You had me at pneumo, but it means lung. But also, I think that might be like the silica particles. I think that happened to a lot of the 9/11 patients, the 9/11 survivors.
Mm-hmm.
And I had a patient several years ago who was a 9/11 survivor, and I think they had that.
Oh wow! Okay. Okay, an adult patient.
An adult. I was a CNA then.
Oh, okay, okay.
But we had a conversation.
Oh wow!
About their history.
Yeah, yeah.
And I think that they may have had this.
And
because
they may have had it because of what, the symptoms they had?
No, I think I remember them telling me something along these lines. Like, I'm not positive it was this word, but it was very similar to this word.
Okay. Okay.
But it was caused by all the particles they inhaled when the towers fell.
Yeah.
On 9/11.
Okay, that's interesting. Okay. Amanda, why did you choose A?
So pneumo, like she said, lung. And then I was honestly waiting for something to pop up saying something about like volcanic ash inhalation or something, but it didn't pop up. So I'm thinking the same thing. It's from like ash and things that are inhaled. So like volcanic ash or, all the buildings collapsing in 9/11. I mean, that's a really good example.
Okay. All right. Well, let's see if you're both correct. And yes, you both are. Very good, very good.
See, we have the brains.
We have brains.
We're so smart.
We are. I agree.
Oh my goodness. Okay. So this wraps up today's episode, and we have a clear winner. This Tara. Woo!
Cool.
Very good, very good. All right. So this wraps. Oh, and also you're going home with a Gemsy scrubs. A Gemsy scrubs of your choice. So you can go on the website www.gemsymart.com www.gemsymart.com. Look at which one of the designs you want, and let us know, and we'll make sure you get the scrubs. And Amanda, you also get a Gemsy scrubs.
Thank you.
Very good. So this wraps up today's episode, and congratulations to both of you for demonstrating rapid critical thinking and excellent patient care instincts. I'm surprised you guys got the last question. I guess the pneumo that gave it away. Now, for our audience, remember to not use the information here as a basis for your clinical practice at work. Be sure to always follow your facility's protocols and collaborate with your care team. Thanks for watching. Don't forget to like, subscribe, and tell us which specialty you want us to do next. Okay? All right? Good day, and have a safe shift to all our nurses out there. Bye-bye.
Thank you. Bye.